Nancy Krieger. I'm professor of social epidemiology at the Harvard T.H. Chan School of Public Health, American Cancer Society clinical research professor, and also the director of the Interdepartmental Concentration on Women, Gender, and Health. And I'm a social epidemiologist and also engaged in different forms of work for promoting health equity and social justice. Been engaged with issues of biology, of history, and concerns around social justice ever since college, if not before. And I found that ultimately public health and this kind of work that I do are the ways to bring these different interests together and to generate knowledge that's needed to help make change. I focus a lot on U.S. health in terms of the specific research I do, but clearly climate emergency and global health inequities are the huge interlinked threats. And they're related in part to what is been the case of what the U.S. government and the current administration has been doing in its policies, and particularly around climate change, but also economic pacts around the world. So there's many different ways in which the U.S. plays a key role in global health inequities, but also it's not just the U.S., it's about the questions of about how the economic systems work to generate and produce the growing levels of wealth and income inequities within and across countries, and as related to the reliance on fossil fuel and the growing grave danger of climate crisis. Both new conceptual ways of framing health inequities, of new ideas to help think about them, to guide their own thoughts for their own work, for their analysis and understanding, as well as some specific information about how it's played out in relation to different kinds of studies that I've done, different measures they can use, different ways of designing the research, different ways of generating knowledge that has not before existed to address these gaps in understanding and insight that can actually be relevant for work that's going forward to promote health equity and fight for health justice. They can learn. That's the key thing students are supposed to do, is learn. They can learn about the ideas, they can learn the history, they can learn that they themselves can do research that asks these kinds of questions, begins to develop methods to help answer them, and come up with data that are useful to the groups that they talk to at the outset who need this kind of information to advance the work they're doing for social change, for justice.